Options is about not giving up, is about giving people a chance to make a change and to stay alive.
Options liaisons are non-judgmental people that will meet you where you're at. We won't be shocked by anything that you come to us with. We're going to find you resources to meet those needs.
There's no real cookie-cutter solution for substance use disorder. The causes are complex, and we can deal with the complexities of substance use disorder with the options program. We can address issues of trauma and mental health and get people the help they might need. We can look at basic needs, food, shelter, and clothing. We can talk about employment, unemployment.
Here in Penobscot County, we do a lot of outreach within our homeless community. We work with a nurse practitioner that does street medicine with us, and we try to make sure that people know where the resources are when they're ready for them.
I always like to tell people they're the driver of their own life. I'm just a roadmap in the car with you, and I have advice. I have routes that I've heard of that have worked and may not have, and I'm here to serve you. I'm here to serve whatever choices you have within the options of substance use disorder, recovery, maintaining recovery, harm reduction, whatever pathway it is. I'm here to support you.
You might get a call from the hospital or get a call from local law enforcement saying, hey, we've got somebody we'd like you to talk to. I could be responding to something, to an overdose, post-overdose. The focus is always on working with individuals, to me, on the referrals and that kind of stuff. And we do a bunch of other stuff in the community. We distribute Naloxone. We might do some educational pieces with law enforcement officers. The focus always comes back to work with individuals, and that's always a priority.
If I can get some of those folks Narcan and make sure that they're not using alone, then that's a positive, and that's gonna, hopefully keep them alive to the point that if they do get to somewhere where they say, okay, maybe this is an issue that I should think about addressing, then they're still alive to get to that point. As somebody who experienced mental health and substance challenges myself, there's a lot of stigma in the community. Treatment and recovery doesn't necessarily have to be abstinence. It could be just seeing an outpatient therapist and going to AA. It could be joining some sort of church or religious or spiritual community, or going back to school and whatever it is for that person. That's the ultimate goal.
A lot of times people that we're working with have never had a good interaction with law enforcement. So one of the things that we take as a small win is giving people positive interactions with law enforcement. But we do make sure the clients know that everything we do with them is 100% confidential. Our law enforcement partners are really good about respecting that boundary. A lot of times I've seen when people are struggling with addiction, they feel very alone. So we try to make connections with people, make sure they know that they're not alone in the moment, that there are people that care about them and want to help them.
The best baseball player strikes out. The best football player fumbles a ball. You don't give up, you just keep going.
I think what I'd want people to take away about the options program is that we're all human. We all make mistakes. We all do things that we wish we didn't. But we all learn from them, and we all care. I do get referrals that when I go up to the door, they put their hands up or they put their hands in their face and they say, "Not you again." And I say, "Yeah, it's me again. I really care about you."
The beauty of options is we never give up on people. We keep coming back. We've seen them in their worst places and we can see them in their better places. And we know that this isn't a one-shot deal. And it takes time, and you gotta keep going back and building till you build the trust. I'm old enough to retire. I don't plan on it because I feel young again, and I can see a difference going out to the camps where people are living and seeing their face when you're out there, not to get them in trouble, out there to give them help. It's a huge difference. It just makes me feel good again about what we're doing.
Options liaisons all have online referral forms. Anyone can be referred to an options liaison. We have a really great website. You can find your liaison by county and see a ton of resources for what county you live in.
If you or someone you care about are struggling with substance use, know your options to stay safe, get well, and stay well. Visit knowyouroptions.me.